Our top focus story on the broadcast is rising COVID cases amongst children. Schools are having COVID tests done. We'll show you images that should concern you. Young children, little girls having that COVID-19 swab in their nose and how they react to this. But some schools in Surat in Gujarat, some in Rajasthan, in Mumbai, you've had some instances, and in Punjab, Class 10th and Class 12th board examinations have had to be postponed because of a spike in COVID cases. So in the past 24 hours, you've had about 25,000 COVID cases across the country, 15,000 in Maharashtra, 1,818 in Punjab. Should you be concerned? Take a look at this report.
As India witnesses a sudden surge in coronavirus cases, fresh worries are emerging. Parents and health experts are concerned about the rising number of COVID cases among school-going children. As many as 36 school students tested positive in Surat district of Gujarat in the last 24 hours. COVID cases have witnessed a big rise in Surat since February 1st, when educational institutions opened in the city.
1 લાખ કરતાં પણ વધારે ટેસ્ટિંગ આપણે સ્કૂલો અને કોલેજોની અંદર કરાવ્યું છે અને એની અંદર અત્યાર સુધીમાં આપણને 86 જેટલા કેસીસ પોઝિટિવ મળ્યા છે અને જે શાળામાં જે ક્લાસમાં પોઝિટિવ મળે એ ક્લાસને આપણે પ્રોફેશનલ કન્ટેનમેન્ટ એરિયા તરીકે ડિક્લેર કરીએ છીએ અને ત્યાંની બધી એક્ટિવિટીને આપણે રિસ્ટ્રિક્ટ કરીએ છીએ.
But this trend is not limited to Gujarat alone. A cluster of coronavirus cases was detected at a government school in the Mancherial district of Telangana. Those found to have contracted the virus included 13 teachers, a class 10th student and 2 cooks who prepared the midday meal at the school.
3-4 days back, oka teacher, bioscience teacher ki positive ochindi. సో తనని ఇంటికి పంపించేసాము. ఎందుకైనా మంచిది అనేసి మనం అందరం చేయించుకుంటే బాగుంటుందనే ఉద్దేశంతో డాక్టర్ వంశీ గారికి నేను కాల్ చేశాను, గవర్నమెంట్ డాక్టర్ గారికి. అందులో టీచర్లకి 12 మంది, వంట వాళ్ళు 2, తర్వాత ఒక అమ్మాయికి పాజిటివ్ తేలింది. ఇక డిఓ గారికి నేను ఇన్ఫర్మేషన్ ఇచ్చాను.
The COVID scare in Telangana comes 6 days after 57 students of a Vedic school in Tirupati district of Andhra Pradesh tested positive. In Haryana's Karnal, 54 students were infected soon after the school reopened. In Maharashtra's Palghar, 79 students, teachers and other staff got the virus. There were similar cases in Punjab, Tamil Nadu and Andhra Pradesh. But are children more vulnerable to COVID-19?
Although children may get infection, the severity is less. And this could be possible because of early closure of the schools during lockdowns.
Medical experts across the world too think that reopening schools will see a COVID spike.
Children do need their education. They do need that social interaction and social contact. But as we know, when schools reopen, then infection rates do rise in the population.
It's a catch-22 situation that state governments are faced with. Children have lost months of school time and need to get back to the classroom. At the same time, there is the risk of COVID spread. The solution is in schools ensuring the most COVID-safe conditions. With Ashish in Hyderabad and Gopi Manyar in Ahmedabad, Bureau Report, India Today.
The corona situation in Maharashtra continues to be grim. The state has reported about 15,000 cases for the 4th day running. Owing to these spiraling cases, the Uddhav Thackeray government has now said that perhaps fresh restrictions may have to be put in place, especially in and around hotspots.
To spiraling COVID cases in Maharashtra. Over 15,000 cases for the fourth consecutive day. The state reported 15,051 cases on Monday with over 1 lakh new infections in just the last 7 days. The worst hit cities remain Mumbai, Nagpur and Pune. The financial capital reported around 1,713 cases on Monday. As Maharashtra imposes stricter curbs, its health minister says that lockdown isn't the answer, but stricter implementation is.
मुंबईमध्ये लॉकडाऊनची शक्यता मी कुठेही म्हटलेलो नाही. त्याचं कारण असं आहे की मुंबईमध्ये लॉकडाऊन कधी करावा याचे काही निकष आहेत. पण हे नक्कीच आहे की मुंबईमध्ये महानगरपालिकेमध्ये 20 लाख लोकांना फाईन केलं मास्क नाही या कारणाने आणि 42 कोटी रुपये यामधून जमा झालेले आहेत.
A sentiment which has been echoed by the centre. The Union Health Secretary has written to the Maharashtra Chief Secretary calling for strengthening of containment strategies, arguing that night curfews and lockdowns have limited impact in containing transmission. This as the situation on the ground remains worrying.
We are in right now Dadar market area, and here you can see how the social distancing norms are not being followed. Now, this is one of the most important markets of Mumbai. From here, vegetables and fruits are supplied to whole of Mumbai. So there will be a lot of crowd over here. But if you can see, the social distancing norms, that is not being followed. Second is people are not wearing masks. Even if there are people wearing masks, they are not wearing it properly.
The Uddhav Thackeray government on Monday issued fresh COVID guidelines to get the situation under control. As per the new norms, hotels, restaurants and theatres will operate at 50% capacity. There is no permission for political, social and religious gatherings. Only 50 people will be allowed to attend weddings and 20 people will be allowed to attend funerals. Any violation will attract heavy penalties.
As cases in Maharashtra rise, Uddhav government has left it in the hands of people to follow norms or face lockdown. While the centre has warned Uddhav government that Maharashtra is in the beginning of second COVID wave, in the coming days, the situation will be under close watch. With Saurav Akhtania, Mustafa Sheikh in Mumbai for India Today.
So the second COVID wave is a cause for concern. An equally big, if not bigger cause for concern are schools in several pockets in our country becoming hotspots. Joining me on India First are Dr. S.K. Sareen, Director of the ILBS, and Avneeta Beer is Director and Principal of the R.N. Podar School. If I could ask you, Ms. Beer, where are we going wrong if 36 children in one instance, 20 in another, when school children are turning positive in large numbers? Are schools to blame? Is the administration to blame? Are parents to blame?
Well, I think in the city of Mumbai, none of the schools have opened. So the children haven't been coming to school at all because despite the fact that the Maharashtra had opened up the schools, in Mumbai, the BMC did not allow schools to reopen. So our children are not in school.
Ma'am, if you were watching our report, we were talking about Surat, for instance. You know, Surat has 36 children in one particular school. If you were watching that report, you would have seen that in Punjab, they've had to postpone board examination by 1 month, class 10th and class 12th. So this isn't a problem that's restricted just to Mumbai. It's a problem that's across the country in various pockets.
That's true. So, of course, we do run the risk of, the pandemic affecting the children and it's spreading through children, and also because children are traveling, and especially in a city like Mumbai where they travel by local transport and teachers travel by trains, the chances of the spread are that much more. So definitely schools therefore become very sensitive hubs.
Dr. Sareen, in your appreciation, did administration in, whether it's in Gujarat or Rajasthan or Punjab or other parts where we are seeing a large number of cases in schools, did they jump the gun? Did they open schools too soon? Or schools have to open? This is something we have to learn to live with, and we need to learn to live with it with precautions, sir.
Well, Gaurav, you have a very important issue which is grappling not only India but rest of the world. Three things have to be remembered. Where are the students living? From where are they coming in a way? And the teachers, and then the type of exposure. If you are in a locality where already there is a surge or a high number of people who are infected, and if the children or teachers are coming from there, I think if they mingle each other, there is likelihood to be further surge because it is less likely that norms can be followed when the kids are playing. The second part is, in my opinion, the children are most disciplined. You teach them whatever, they will do exactly the same. If you tell them to stand in a line, in a queue, they will do that. But if they find others are not following, like their seniors are not following, or their parents or the society is not following, you don't expect the kids to behave. So first thing is we have to understand the locality. Now your question is whether the government has done right by opening early or not is a question which will depend on the state as it is. There are several instances which are there in our literature also that people they have opened the school, but there has been no surge except when they were opening the bars in the school, the opening of the eating areas, or they were having very aggressive sports. Only then the spread has occurred.
Okay.
So, in my opinion, if we are very careful that there is a kind of a bubble, let's say there is a class fifth, the teachers, the students of class fifth are knowing each other from where they are coming. If they are behaving, if they are following the norms, I think it will be a good idea. If not, if the class fifth is mingling with class eight, they're coming from a different school, the teachers are coming from different places. If these things have not been taken care by the schools, there is a fear of a spread. And one thing is certain that eating.
So, in your appreciation, schools have to open. Schools have to open. Our society has to open up. It's just that those precautions need to be taken. Ms. Beer, in your appreciation, at what level should schools, reopen and go from online to offline? 10th and above, 8th and above, 6th and above, or if you follow appropriate precautions for everyone, ma'am?
I think one has to take baby steps, especially keeping in mind the local conditions. In a city like Mumbai, like I said, it is more prone and more sensitive, especially because people are traveling by local transport. So I would say grade 9 to 12 to begin with, and then, gradually, once you're more comfortable and you feel that you can cope with and the situation you have controlled in your school, then take small steps gradually. So it cannot be, we cannot go back to, it's not life as normal. So, while we may think that normalcy has resumed, it is it is not so. So we need to be extremely careful when we are reopening the schools, and we have to go step by step.
Dr. Sareen, there is no vaccine for children. The vaccine is only for people of 60 and above or 45 and above for comorbidities. In your view, time to open it up for more people to be vaccinated. As far as children are concerned, how can they stay safe apart from school? A safer environment for them is wearing a mask or maintaining what you describe as COVID appropriate behavior. Is that the only road ahead, sir?
The vaccines are approved for 18 and above, and therefore all the school teachers certainly should be amongst the priority line now. If you are opening schools, the school teachers must be vaccinated so that they do not actually bring infection or take infection away. And of course, they have to wear. So one important segment is the teachers and their behavior and their discipline. If they mix up in the classrooms, it's not going to work out. The second part is, you're right, there is no vaccine right now, although several trials around the world are going on for kids and the COVID vaccine. And I hope by May end, we will have some results. And therefore, till the time we have the results of the vaccine, and then we start vaccinating the kids, we have to teach them, and we have to teach their parents especially, that they have to have that 6 feet at least distance and not eating in this classrooms and others. Another important thing, any kid who is sick, the parents must inform well in advance, and all those who are in touch with their children, they must be quarantined or they must be tested, because They are not just reporting to the sick room. It is the whole community. That bubble of school class must have to be looked into. I think therefore we have more challenges, and I totally agree with and compliment the other panelists. Yes, we have to go baby steps. We have to see that a given school and a given administration can comply with the norms, and there are no cases there. And as in UK, Wales, and Scotland, all the kids are at
Okay.
least tested twice in a week. And if they are at home and then they are coming at least once at home, we are not testing our kids. I would suggest that in the beginning it is not a bad idea, and it will give them a sense of responsibility that they have a rapid antigen test done at least once or twice a week when they are going to the school, and they are also to behave and see that masks are properly worn.
So every child you recommend gets a rapid antigen test once a week.
Yes.
Again, this would lead to a lot of costs being incurred. That's point one. But point two, is a bubble even possible, ma'am, in schools? In government schools or in schools apart from those big posh private schools? Is a bubble even possible, that teachers don't intermingle or students don't intermingle? How do you instill that sense of discipline amongst children?
And as I said, I think we need to we need to be cautious. So we need to go step by step. Perhaps maybe we should call children not every day of the school. Maybe we could call them 3 days in a week, and gradually, they get trained to, and we're able to monitor them, and we're able to instill in them the sense of responsibility. It may not happen. So I'm just saying that, we have been carrying on the online mode. And if we waited this long, I think we should not rush into being, reckless. I think we need to exercise caution. Take baby steps. Like I said, I keep saying that it's not business as usual. It's not school as usual. Getting children, and also, you see, we will have to get children coming. Maybe we'll have to have a hybrid model where some days some children are coming, then the next few days some other children are coming. So we call them in shifts. Gradually, instill in them the sense of responsibility and maintaining, social distancing, all of that.
60 to 70 children in a school bus, 40 to 50 children in every class. How do you ensure social distancing, especially at lunch break or games period, or if they're going to the lab? All of this would be extremely difficult. And Dr. Sareen, is there a fear that once children return to school, you have hotspots in some areas where children return to school, those hotspots could then increase to newer places? And is a second wave restricted only to parts of Maharashtra, or do you fear a second wave maybe in Delhi or maybe across the country, sir?
I totally agree with you. There is a fear, there is a lurking fear, and till the end of March or April, if Delhi passes without any more surge, it will be very lucky. But there is a fear in our mind, the cases might spiral up. And you're right, if the buses are packed or the classrooms are packed, I think we have to reduce the number. We have to see that more open spaces are used. And if there is no urgency for a given class, like you have taught them for almost a year online, it would be worthwhile. We can wait another few months for younger kids, only those who are going to have practicals or those who have to have a board exam kind of a thing. We should do that. And remember that the hot spots in the school can be very, very crucial, because the kids may come from very far off distances, and tracking them or having containment in those areas may be very difficult. So extra caution and responsibility lies on the school administration and of course the parents. So I would say be cautious, go slow, but younger kids, and the other good thing in the kids is that they do not get severe disease, but they do get diarrheas. So their motions, a very, very important part is where they are defecating. So if they are defecating where there is a common place, then the toilets, those areas can also be very vulnerable for further spread. So you may not be in direct contact, but the toilet is used by multiple kids. It can be a big source of spreading infection.
Which they are in schools. Absolutely, absolutely. Cleanliness in washrooms, that's so important, and perhaps often neglected in many schools. So that is one area where a lot of focus needs to be paid.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.